Welcome to our practice. You've made the right choice in consulting a doctor of chiropractic. You join a growing number of parents worldwide who have found improved health for their family through chiropractic care. As a parent who is perhaps new to chiropractic, you may have some questions about your child's care. Two of the most common questions from parents centre around, firstly, whether chiropractic care for their child is effective. In other words, will it help? And secondly, whether chiropractic care for children is safe. These are great questions. Well, let's take a look at what we know. The research demonstrates clearly that chiropractic care for children is effective, as well as being remarkably safe, with an associated high level of parent satisfaction. In a recent investigation conducted by the Victorian Government in Australia, nearly 22,000 parents shared their experiences with chiropractic care for their children. A staggering 99.7% of these parents reported positive outcomes from their children's chiropractic sessions. These parents sought chiropractic care for a wide range of issues, including concerns about posture, colic, neck discomfort, difficulties with breastfeeding, as well as back pain, and headaches, just to name a few. What is remarkable is that following these chiropractic sessions, approximately 98% of parents noticed a marked improvement in their child's well-being. 98%! So we know chiropractic for kids works. Another primary focus of this inquiry was safety, and the findings were certainly very reassuring for parents considering chiropractic care for their child. The investigation found minimal evidence of any harm resulting from chiropractic treatments administered to children in Australia. Specifically, of those nearly 22,000 children, there were no instances of complaints or notifications regarding significant harm to children following their spinal adjustments. Not one out of nearly 22,000 children. As caring parents, these findings should give you comfort that you are in the right hands, and that with a thorough examination and appropriate safe and gentle techniques, you can confidently entrust your child's well-being to chiropractic. Another common question from parents is, why is chiropractic important to my developing child? Others ask, how can chiropractic influence conditions such as colic, bedwetting, growing pains, or perhaps an infant who is missing developmental milestones? Well, let us again look at what we know. It is a well-known fact that every cell in your child's body requires a nerve supply from their brain to function optimally. These messages travel to and from the brain through the spinal cord, which is housed in the spine. Sometimes, for a variety of reasons, your child's brain-body connection can become compromised. So how might this occur? Well, let's have a closer look at the spine. The flexibility of your child's spine also makes it potentially vulnerable. Misalignments of the vertebrae can cause abnormal pressure or irritation on nerves, muscles, and ligaments, a condition known as vertebral subluxation. Chiropractors specialize in locating and identifying vertebral subluxations, and then specifically eliminating the resultant interruptions to the nerve flow. This is essential for the growing child because we know that input to and from the brain is vital to provide the appropriate stimulation to higher brain centers to create new neural pathways which promote normal development. If there is incorrect input or altered information, then brain development and growth can be affected, which can create gaps in a child's learning and progress, which may manifest as delayed or missed developmental milestones, and perhaps learning difficulties as the child gets older. We know that chiropractic adjustments improve input to the brain, and for this reason, our advice is that all newborn infants should be checked by their chiropractor soon after the birth. To many parents, this is a surprising revelation. The unfortunate truth is that problems with the spine and nervous system may develop very early, even potentially before your child is born. The position of the baby in uterus and the birth itself may place excessive strain on the spine of the infant. This may or may not lead to some telltale signs in those first few weeks that things are not as they should be. Perhaps the child has latching on issues when feeding. Maybe there is restricted head movement. Perhaps the infant favours one side when breastfeeding. Perhaps flattening of one side of the baby's head. Or maybe there are colicky symptoms such as excessive crying. There are actually many studies that have demonstrated that chiropractic care can significantly reduce periods of crying in colicky infants. A study in 2007 found that excessively crying babies were at least 5 times as likely to cry significantly less, up to 3 hours per day less, if they received chiropractic care compared to those who did not receive chiropractic care. And what about after the birth? That exciting adventure of learning to roll, sit, stand, crawl, and walk. Along the way, your child inevitably takes plenty of tumbles and falls, which can potentially lead to spine and nervous system issues. We know that what your child experiences in their early years affects the way their brain develops. The research tells us that gently and safely adjusting your child's spine may positively influence the brain-body connection, while at the same time respecting your child's innate ability to heal itself. Put simply, chiropractic helps your child to achieve their maximum health potential. So well done, and congratulations on making the decision to embark on this exciting journey with your family.